In this section, we'll discuss the systemic veins. Okay, let's begin. The veins have several features. The veins is with thin walls and larger lumens, also with venous valve, venous plexus, and also venous ridge. There are two sets, the superficial vein and the deep vein. There are also some special structures. For example, the thinness of durometer and duplexer veins, and there are plenty of anastomosis. This demonstrates the venous valve. This picture demonstrates the sinuses of durometer and diploid vein. The pulmonary vein. They consist of two sets of vessels, the pulmonary and the systemic. The pulmonary vein contain anterior blood, which they return from the lungs to the left atrium of the heart. The systemic vein, it returns the venous blood from the body to the right atrium of the heart. The systemic vein may be divided into three groups: the superior vena cava and its tribute, the inferior vena cava and its tributes, and the veins of the heart. They return the venous blood from the body, except the lungs. Superior vena cava and its tributaries. Head and neck veins. It mainly has three branches: the internal jugular vein, external jugular vein, and brachiocephalic vein. This picture demonstrates the main branches of brachiocephalic veins, as demonstrated in the picture. The internal jugular vein is mainly have two branches, the facial branches and the retromandibular veins. This picture displays the branches in detail. This is also a demonstration of the branches. Veins of the left limb. The deep vein also have the same names as the accompanying arteries. The superficial veins, there are three: cephalic vein, basilical vein, and the medial cubical vein, as demonstrated in the picture. The superficial vein of the lumbar limb. This is the illustration. The deeper vein of the upper limb is mainly a branchial vein and ulnar vein and radical vein. It also includes subclavian vein. Thoracic vein. It has several branches. They are superior vena cava, azygos vein, also hemiazygos vein, and exterior hemiazygos vein, and veins of vertebral column. The azygos vein may connect with the below, the hemiazygos vein, and the axillary hemiazygos vein. This picture demonstrates the relationship of the three. Inferior vena cava system. Veins of the lower limb. Deep vein also have the same name as the accompanying artery. As for the superior vein, it includes the greater saphenous vein and the smaller saphenous vein. The inferior vena cava and its tributaries. The inferior vena cava can branch into the common iliac veins. The common iliac veins can also include the internal iliac vein and the external iliac vein, as demonstrated in the picture. The lower limb. This is the superficial veins of the lower limb. This one is a small saphenous vein, and this all the superficial veins. The deep veins of the lower limb is mainly the femoral vein and the popliteal vein. The tributary of the inferior vena cava. There are several branches. The parental tributaries include inferior phrenic and lumbar vein, inferior phrenic vein, lumbar vein, and ascending lumbar vein. The visceral tributaries. These are the testicular veins for the male, the ovarian veins for the female, the rectal vein, the suprarenal vein, and the hepatic vein, as demonstrated in this picture. The hepatic portal vein. There are several tributaries. They are superior mesenteric vein, splenic vein, inferior mesenteric vein, left gastric vein, right gastric vein, cystic vein, and parahylic vein. There are also anastomosis between the hepatic portal venous system and the vena cava system. They can communicate with the esophagus venous plaques, the vital venous plaques, and also the periumbilical venous ridge, and the union between small veins. It can also communicate with the vertebral venous pelvis. This picture demonstrates the communications. That's all for this section. In this section, we mainly discuss the systemic veins. Thank you for your attention.